Afternoon. Today's topic for the live interaction with all our friends is ear discharge and deafness. So let us see the ear discharge first. Most of the times, ear discharge is from the middle ear. In the earlier discussions, we have understood that ear has three parts: outer ear, middle ear, and inner ear. The ear discharge mostly is from the middle ear. Whenever there is a perforation in the eardrum, or when there is a cholesteatoma in the middle ear or mastoid cleft, we will be having the ear discharge. When there is infection in the external ear, also we will have the ear discharge. So, when there is a perforation in the eardrum, the ear discharge is called a safe ear discharge. That means there are less amount of complications associated with this kind of disease. In a safe ear discharge, the discharge will be profuse, non-foul smelling. There is no smell, that means never blood stained, and usually is white to yellow in color. And it is not associated with ear pain. This kind of ear discharge is called chronic suppurative otitis media, and this is a tubotympanic type or a mucosal variety. In this kind of ear discharge, there is a perforation in the eardrum wherein there are margins all around, and it is not a bone eroding disease. On the contrary, you have CSOM with cholesteatoma or squamosal type or atticoantral disease. In this kind of disease, the infection is because of the cholesteatoma, is a bone eroding disease, and infection can spread to the adjacent areas by destroying the bone. That means the ear bone is destroyed slowly, progressively, and it can reach the brain and it can have a infection into the brain. In fact, today our program got delayed by 15 minutes because we started one patient who has developed infection in the ear because of cholesteatoma for the last 10 years, and for the last 1.5 months, patient is having bad smell, foul smelling, discharge, blood stain discharge, and giddiness, and near total loss of hearing. This is happening for the last 6 weeks, and gradually it has worsened. And the patient came to our hospital yesterday night with the complaint of high-grade fever, chills, and discharge from the ear. So when we did the investigations, we found that there is cholesteatoma in the ear, eroding all the walls of the ear bone and extending into the brain, causing an abscess. This is a subdural abscess what the patient had. Intracranial, brain meninges, brain covering abscess. And we started in the morning this surgery. We cleared the infection in the brain first by the neurosurgeon. My senior neurosurgeon colleague, Dr. Narsimha Rao, helped me in this case. He did his part, and then we cleared the infection from the mastoid bone. And it took nearly around 6 hours surgery. Now patient has recovered very well. But all this is to be avoided. Now the patient has to stay in the hospital for next 14 days, receiving anti-meningitic dose of antibiotics. That means high dose of antibiotics for the recovery. In spite of the good surgery, good medical treatment, there is risk to the life is around 2 to 3%. The risk of other complications is still there is around 5 to 10%. But all this can be avoided by taking early treatment for a cholesteatoma disease. So here, usually the question is how to identify a dangerous or a cholesteatoma type of ear infection. Here, the discharge is foul smelling. It will have a bad smell. It is watery discharge, very minimal ear discharge. And it stays for a long time. Whenever there is a complication, that means when the infection is spreading into the brain or inner ear, there will be giddiness, there will be sudden worsening of the deafness, severe deafness, profound deafness, and blood-stained ear discharge. Whenever you see such things, you have to suspect unsafe CSOM or dangerous discharge from the ear. And this has to be treated surgically only as early as possible to protect the life from the dangerous side effects and complications. Whenever infection goes to the brain, either meningitis or brain abscess or subdural abscess, they are very dangerous, and untreated, they have 100% risk to the life and rebirth of the individual. So the other kind of ear discharge is profuse ear discharge, not bad smelling, not foul smelling. There is no blood stain, and it is almost continuous. A lot of ear discharge will be there. This kind of ear discharge is because of a perforation in the eardrum. And in these cases also, the risk of injury to the or damage to the facial nerve is quite significant. So this also is to be corrected by surgery. The surgery for this kind of disease is relatively simple, and it will give very good results. So this is about the types of ear discharge from the ear, especially from the middle ear. When the discharge comes from the external ear, most of the times it is because of the fungus. So whenever there is fungus on the body, we will be having itching. So when there is itching and ear discharge, you have to suspect there is fungus in the outer ear. And this has to be removed under microscope by suction clearance, and then you have to use antifungal antibiotic ear drops, and that will give very good result. But the problem with the fungal infections is usually their spores, their seeds remain in the ear canal in the site of infection for a very, very long time, maybe to the tune of 2 to 3 years also. So they require regular care with antifungal ointment once in a week, only one day in a week for their at least 6 months, sometimes even up to 2 years, till the fungus completely disappears from the body. We have to understand that fungus is more senior on this earth than us, and it knows how to live the odd times. So it can survive in the ear canal for a very long time in spite of the medication. So the medication has to be much more longer than the capacity to survive in the ear by the fungus. So we have to be much more tougher than fungus to clear the fungus from the ear. See, this is a very important thing. This is a very common infection in the outer ear, and untreated, neglected, that can result in a perforation in the eardrum. Once there is a perforation in the eardrum, you require operation. So we have to prevent the operation. We have to avoid the operation by taking proper care of the fungus in the ear. So whenever you suspect you have itching in the ear and discharge from the ear, you have to suspect that there is fungus in the ear, and you have to take the treatment, antifungal ear drops. Please don't take antibiotic ear drops. One of the commonest mistake done by our friends is using Cifron or gentamicin ear drops. And when they use the ear drops, the bacteria, this is antibiotic, right? So when you use antibiotic ear drops, the antibiotic will kill the bacteria in the ear canal. In fact, in a normal healthy individual, there is a balance between the bacteria and fungus in the ear canal. When you kill one of the warrior, the other one will take over the war and will win the war. So what happens when you put antibiotic ear drops? The bacteria are killed by the antibiotic and the fungus will flare up. So all these medicines are to be used very judiciously. Please don't use the medication on your own, and that is very dangerous. That's why I keep telling all the medicines are double-edged swords. Means they can help you and they can damage your body also. So you have to use the medication very judiciously, and that doesn't mean that you should not use the medication, you should not use antibiotics. Some people sometimes they take the message that we should not use antibiotics. No, that is not correct. We have to use the antibiotics and other medication judiciously and in such a way that the benefits are more than the risk. For every medicine, there is a definite amount of risk, there is a definite amount of benefit. So when the benefit is much more than the risk, this medicine is safe, we have to use, you can use them. So when there is no disease, if you take the medication, that is not good, that will disturb your body. For example, I'll tell one thing. Viral cold, there is some infection in the nose, viral infection. And if you take antibiotic in a viral infection, you will not get any benefit. Rather, the antibiotic will trouble your body. You will get only trouble and no benefit. So when there is a bacterial infection in the nose or in the throat, you take antibiotic, the disadvantage of the medicine is same, but the benefits are much more than the disadvantage. So I request all my friends to understand that any medication is to be used judiciously. This judicious part is done by the doctor. Unfortunately, this cannot be done by the medical shop owner. I strongly recommend not to buy the medicines on the counter at the medical shop and use them. So, this is especially very important for the antibiotic ear drops. So I think we have a question. Any question is there? No. Okay. Now, this is about the ear discharge. Now let us come to the deafness. When we come to the deafness, the ear canal directs the sound towards the tympanic membrane. That is one part of the ear canal. That is one job of the ear canal. Number two, when the sound falls on the eardrum, this sound is transmitted to a bone called malleus, and from there to the incus, from there to the stapes. And the stapes bone is the junction between the middle ear and the inner ear. When the energy is traveling to the stapes, from there to the inner ear, the fluids in the inner ear vibrate like a wave. When you drop a stone in the pond, there will be waves traveling from the point of the sound, the stone touching the water. And those waves, like that, we'll see the waves in the inner ear also when the stapes moves. This wave energy is picked up by the outer hair cells of the cochlea, and which convert this mechanical energy into the electrical energy, and that electrical energy is transmitted to the brain through the nerve of hearing, also called the eighth nerve. So ultimately, the brain will receive electrical signals, and that is appreciated as sound by the brain. So in this path, starting from the ear canal, eardrum or tympanic membrane, the hearing bones, the malleus incus stapes, and the inner ear. and the nerve of hearing, that is the eighth nerve. If there is any defect in this path, there will be deafness. So, in this part, the most of the cases of deafness are because of the nerve weakness because of the age. That is called presbyacusis. In the presbyacusis, there is a nerve weakness and hearing loss will occur. And for this, since it is because of the age, this is not a disease, we don't have any medical treatment for this problem. But we can help them by arranging a hearing aid in the ear canal. And there are different types of hearing aids available. Most of them are, we strongly suggest behind the ear hearing aid, and they're very useful and they give the hearing, they bring the hearing back to normal. But unfortunately, in our society, there is a taboo associated with the hearing aid, and many individuals, in spite of the hearing loss, they suffer, but they don't like to use a hearing aid. When you don't use a hearing aid, there are certain disadvantages, certain things happen in your mind. One thing is when you